How do you think of psychoanalysis on the one hand as it's practiced today? What does it consist in? And then psychodynamic therapy.
Okay, so these are kind of wiggle words. I mean, the word Freud used was psychoanalysis. Actually, the word he used was German, Psychoanalyse, which was kind of a hyphenation of two words that don't go together, which is psyche, the psyche of mythology, psyche, the soul, the spirit, the breath, right? And this very sciencey word, analysis, and he deliberately combined the words in a way that created a paradox. So, we're dealing with the human soul, but we're trying to approach it in a systematic, rigorous way. So, the word psychodynamic, actually, the history of it, the word came into usage, prominent usage, after World War II. I think it was first introduced in the early 1950s at a conference on medical education, psychiatric education, where directors of psychiatry residency training programs were meeting to consider and discuss the curriculum in psychiatry. And then there were people who wanted very much for psychoanalytic ideas to be incorporated into psychiatry training, which in fact is what happened then. Right? Psychiatry was largely dominated at that time by psychoanalytic perspectives. But the concern was that psychiatry training directors would be alarmed by this concept of psychoanalysis, that even then it would conjure images of, cigar smoke filled European, consulting rooms. The word was a bit of a ruse to get psychoanalytic thinking into the curriculum without alarming people. It's come to be used, though. So let me back up. The word psychoanalysis, as you correctly said, refers to multiple different things. The three major things that it refers to is it's a body of knowledge. It's a rich, and complex literature that has developed for, well over a century. It is a range of different treatments that are informed by this body of knowledge. Right? Treatments plural, not one. And it's a certain sensibility. It's a certain way of thinking about mind and behavior that really could apply across any kind of intervention. I mean, so when I was an attending doctor in a psychiatry outpatient department, I would supervise psychiatry residents, and some of them were dealing primarily with medication. Right? What does this have to do with psychoanalytic or psychodynamic anything? Well, it has everything to do with it. It's not the treatment you offer. It's not what pill you prescribe or the dosage. It's how you understand the person to whom you're providing the treatment, right? So a body of knowledge, a range of treatments based on this knowledge, and a certain way of thinking about and understanding people. Now, the word psychoanalysis proper sort of evolved to refer to one specific kind of treatment, which is typically done, back when, 4 or 5 days a week. Often the patient lay on a couch. This doesn't happen very much anymore. Most of the people who still get that kind of treatment are people who are trainees becoming psychoanalysts themselves. So psychoanalysis proper was, a 4 to 5 day week treatment. Psychodynamic therapy was treatments based on psychoanalytic principles that were typically, once a week or maybe twice a week, and the patient would typically sit in a chair, not on a couch. So, you could think of psychodynamic as, I personally, I don't even like to make the distinction. These are all psychoanalytic therapies, but, psychodynamic is a bit of a broader tent.
First, I want to ask, so when you say that psychoanalysis is a range of different treatments, are you referring, when you say it's a range of different treatments, are you referring to the original psychoanalysis proper and the psychodynamic therapies, or are you saying that there are multiple different treatments of psychoanalysis? Say, there are different a different treatment might correspond to a different condition that is being treated.
Well, every treatment is no two treatments are alike because it's very individual. But there are different schools and models and approaches within the big psychoanalytic tent. And I mean, I personally think it's been harmful to the profession to identify psychoanalysis with one very particular kind of treatment, that involves very frequent meetings on the couch. I mean, that really, that's a very small percentage of psychoanalytically informed treatments. And that's a pretty rarefied kind of thing. And, there's a movement, and I'm part of the movement, to use the word psychoanalysis more broadly to refer to, the range of treatments that are informed by this understanding and this sensibility, rather than reserving it basically for a guild that practices one very specific and very, sort of old and traditional approach to treatment.
Okay, and then one last thing I wanted to clarify is you said that there are very few people on the couch these days. It's mainly trainees. But do you see
not exclusively, but yeah, it's not common.
Do you see any feature of psychoanalysis or psychodynamic therapies that cleaves the two at the joints, so to speak, or is it really just a continuum between the couch practice and then the various psychodynamic therapies?
I think it's a continuum, and I can tell you the continuum. So if you think of it like two poles, defining two ends of the continuum, on one end of the continuum are interventions aimed at understanding and insight, interventions aimed at coming to know ourselves more deeply and more fully, which is really the essence of what these treatments are about. At the other end of the treatment, other end of the continuum, are treatments aimed at providing support, stabilization, shoring somebody up who's functioning, ego functions, or as we now say, executive functions, may be failing. And the fact of the matter is, every treatment includes interventions along the entire spectrum of that continuum. It's really a matter of the blend and where a particular patient and doctor or therapist are at a particular moment in time. So I think trying to make a categorical distinction to me, seems arbitrary and not especially helpful.
And then beyond, so there are these three components that you identify to psychoanalysis. There's the body of knowledge, the family of treatments, and then the way or sensibility of understanding and treating the mind. So
a way of thinking about ourselves as human beings.
And how do you or explain just what this way of thinking about ourselves is that is so intrinsic to psychoanalysis?
Two things stand out for me. I mean, one is the fundamental recognition of psychoanalysis that in some very important ways, we're not masters of our own house. What I mean by that is, by virtue of being human, none of us fully know our own hearts and minds, right? There are levels of awareness, levels of consciousness, right? There's far more to who we are than what meets the eye on the surface of things. And the things that we don't know about ourselves, that we're not aware of, can cause real problems for us in life. Right? So the idea is that by coming to know ourselves more fully and more deeply, we become more whole. I can talk more about what I mean by more whole, but for the moment, we become more whole. We gain the ability to free ourselves from having to live out the same, sort of repetitive patterns that, we're all stuck in to a greater or lesser extent. Right? So the goal of the work, contrary to, caricatures and stereotypes, the goal of the work isn't to dwell in the past. The goal of the work is to be able to live more fully and freely in the present. So that's one aspect, right? The recognition that we're not of one mind, we're of many minds about, pretty much everything that's important. And we can know ourselves more fully through a particular kind of process of exploration. The second is what we call the second part of the sort of sensibility or attitude with which we approach the work is there's a real humility about it. And the humility is that we just reject the assumption that anyone can know what's right for somebody else. Right? What is a satisfying and meaningful way of living for that person? Right? Hopefully, we can find satisfactory answers for ourselves. We don't have those answers for somebody else. So there's a term in psychoanalysis, it's called neutrality. It's wildly misunderstood. What it really means is utmost respect for the other person's, for the patient's autonomy and agency and self-determination. We're not in the business of trying to tell them what's right for them, give them answers, tell them how to live. We're in the business of helping them to know themselves more fully and deeply so that they can find, their own answers to questions about what's right for them.
I hadn't heard of this concept of neutrality before, and it's quite fascinating. And I imagine that it can be quite difficult as a clinician to get past your own preconceptions with certain patients, or for some given clinician to get past their preconceptions.
Yeah, well, that's part of the training and part of the work that we have to do. But I mean, it's actually, it's not that hard to explain. Suppose you have a dilemma. Suppose you have a romantic interest, somebody that you want to pursue a romantic relationship with. And part of you is drawn to that person, and part of you is wary and hesitant. It's a very, very common, human situation. But, imagine most of us have experienced something like that. And a sort of a layperson's perspective on what would be helpful to that person would be, oh, well, let's understand your situation. I'm going to give you advice, right? I'm going to figure out what's right for you, right? And, and then encourage you to do one thing or the other. But another way to look at it is the person is in conflict. The person is of two minds about what they feel, what they want, what they think is right for them. And so we could say there's two or more parts of the self that are, operating at cross purposes or in conflict with one another. And neutrality means, technically, specifically, I'm not going to take sides with respect to the internal conflict. I'm on the side of deeper understanding. So what I'm actually on the side of is, can we make space to really hear deeply and fully from both sides of the conflict, right? Usually people come in and they're kind of identified with one side. There are two minds about it, but they're aware of, they identify with one set of feelings or desires. The opposite, or the contradictory set of desires, is kind of operating, from the shadows. And we get to hear a lot about one side of the conflict and not so much about the other. It kind of goes underground, except it's still exerting its influence. What we say is, let's hear from all of the different parts of you. Let's bring everything out of the shadows. We're on the side, not of this solution or that solution. We're on the side of understanding all of the different parts and pieces and facets of who we are. And out of that understanding comes the possibility of resolving those inner contradictions, resolving those conflicts, finding a way to make choices and decisions, with a sense of sort of harmony, where all the different parts and pieces of us are working in concert rather than at cross purposes. And they're working in concert because they've all come within our awareness and our understanding. Right? So neutrality is not taking sides with respect to the person's internal conflicts, but being on the side of understanding and insight.